Welcome to the Mama Stay Fit week by week pregnancy update. We are now in week 28, so welcome to the third trimester, the final trimester, but you still probably have like 10 to 13 weeks to go. So still a lot of time. But in this video, we're going to share what can you expect is going on with baby now that we've entered the third trimester. What might you be experiencing during this week of pregnancy? And then also, how am I feeling? Because I am currently pregnant with baby number 4 and finally in the third trimester. It feels like it's flying by, but again, I still probably have like 12 or 13 weeks to go. So
this
plenty
is when
of
it
time.
slows down.
Plenty of time. The last month of pregnancy is 400 days, apparently.
Yeah, 400 years.
But before we dive into what to expect during week 28 of pregnancy, I want to share that my book, Training for Two, is now available for pre-order. Training for Two is all about how you can use your prenatal fitness throughout your entire pregnancy to include the third trimester to stay strong throughout your pregnancy with lifting modifications for each trimester, pain-free because pain is not a requirement of pregnancy. And we're going to discuss that in this episode as well, with pelvic stability and core exercises, and then how you can use your prenatal fitness to help you prepare for birth, which is a big component of the third trimester. A lot of us are realizing now that we have to actually give birth at some point. And so in the book, we incorporate a lot of exercises to help you prepare for birth with pelvic opening and pelviform release. You can check out the book in the notes below. The book comes out September of 2024. So Roxanne, what is going on with baby in week 28 of pregnancy?
So week 28, like you said, the first week of the third trimester, last haul, almost there. But week 28, baby's the size of a romaine lettuce head. So before we were like the Napa cabbage, now we're a romaine lettuce, which I feel like is a pretty big. But it's also, if you know what this is, the Kit Cat Klock. Kit is K, cat is a C, and then Klock is with the K. It's like the black cat. That's a baby. It took me a while to remember what that was, but that is what baby is also at week 28, if whichever one resonates. I think one place said it was an eggplant, which we were like an eggplant a couple weeks ago, so we're just going to ignore that one. But during week 28, there's a couple things happening with baby. Number one, baby is now starting to go through those sleep cycles. Baby is starting to enter into like REM sleep, having dreams while they're like in the womb, hopefully dreaming of you, but who knows what they're dreaming about. But they're going through these sleep-wake cycles now. And like they've done studies where baby actually enters into REM sleep, which is really, really cool. But this is when we normally recommend starting to do those kick counts. And you can do like the traditional kick counts of like sitting down for 2 hours and like just noticing your baby's kicks. Once you get 10 kicks, then you're good to go. And this reason we recommend doing kick counts or just noticing baby's movements is because it could potentially identify when baby is having some sort of issue. So when baby is moving, this is a sign that they're doing well and they're thriving in the womb. When they start to decrease in the movements, this is usually just like when we get sick, we don't really want to move as much. So similarly with babies in the womb, that potentially when there's an issue, they may not move as much. So if we can identify that before, this could lead to decreasing the preventable stillbirths. So you can do it the traditional way that they teach usually at your clinic where you sit down for 2 hours, wait for those 10 kicks. But that's not necessarily the best way. The best way is to notice what your baby's normal movement patterns are. Because some babies will move 25 times in like 14, like you'll sit down for those 2 hours and they're moving like 20 to 40 times. They're like really, really active. And some babies might not move as much. So you will do those 2 hours and you'll only get 9 kicks. And so then every time you're doing your kick counts, you're going into the hospital. But this is your baby's normal. So noticing what your baby's normal is and then noticing when there is a change from their normal is a better indicator of when to go in and seek help. So if your baby is either active, like crazy active, where they're moving 40, 50 times in a minute, and then all of a sudden, maybe now they're only moving like 20 or 30 times, or they're just not moving as much, but they're still moving. That is still a significant change that needs to be assessed. Similarly, if your baby only moves like those 9 times in that entire 2-hour period, you're going into the hospital when you necessarily don't need to. But when baby does have those decreases, you'll still notice that change.
So something that I do to help kind of track baby's movements and something that I've done in previous pregnancies and I'm starting to do in this one is I just have like a note on my phone. And when I'm feeling baby moving a whole lot, I just kind of annotate the general time. I'm like, all right, at 9 a.m., she's really active. Okay, at noon, she's very active. And so I just kind of like take note of the times that she's more active throughout the day, because I know that that's kind of with her sleep-wake cycle. And then when I notice a change in that from day to day, then I'm like, okay, is this normal? Is she just like maybe more sleepy today? Like, should I go see my provider? So I find that to be really helpful as opposed to like sitting still and being like, okay, they moved 2 times. Like, cool. The other thing to be aware of is when we're doing kick counts or we're monitoring baby's movements, we want it to be voluntary movement. So hiccups would be involuntary. It's just like a reflex that is happening. We want it to be like little punch and kicks that are happening as the movements that we are counting. And if you're doing the 2-hour kick count time frame, we just want it to be the same time every day as well. Because again, we don't want to do it during one day at 9 a.m. when baby's really active, and then the next day at like 10 a.m. when baby's taking a nap, because then you might be alarmed that baby's movements have decreased. And it's also important to note that baby's movements are going to stay the same. They're not going to decrease as you get closer to your due date as well, because sometimes that's a myth where folks are like, they run out of room and so they don't move as much. Like, that is not true. Babies should still be moving. However, the movements may feel different for you as they get bigger.
Because they just don't have as much room. So they don't have like their kicks, they don't have as much room to like wind back and punch you. Like they're going to be different movements, but they should still definitely be moving. And that's an important thing to note with the kick counts. Kick counts can be very anxiety inducing though for a lot of people to sit down and like do those 2 hours. And that's why I also find that intuitive, like just knowing your baby's intuitive and normal movement pattern is a little bit less stressful, because just noting like Gina said, like, oh, 9 a.m. baby's moving a lot. Oh, yep, it's 9 a.m. baby's moving a lot. Or like, oh, it's 11 a.m. and I haven't really felt baby moving a bit, but normally at 11 baby's not moving, so I'll wait until like noon. With these kick counts though, if you notice that there is a change, go to the hospital. Like, some people will be like, oh, try to drink water, like drink something sugary. No, do that on the way to the hospital. Like, drink your sugary drinks on the way to the hospital, drink the cold water to see if you can get baby to move. But like, drinking cold water is not going to make your baby instantly better if their movements have already started to decrease. It's better to go into the hospital to get assessed, like both you and baby, and then to tell you that, okay, baby is doing fine right now. We did all these tests. Baby still looks good. If you continue to notice a decrease in the movements, come back in, because I'd rather you come into the hospital every single day just to make sure baby's okay if you're feeling a change in their movement than for you to not come to the hospital and something actually be wrong.
So with my own doula clients, there's a few things that I don't mess around with at all. And so if they let me know that they're noticing decreased movement, my initial recommendation is just go and get checked out, because that's not something that we want to mess around with. Decreased movement can be a sign that baby is having a little bit more trouble. And so it's definitely our recommendation to go and see your provider, go into triage, as opposed to trying to stay home and see if drinking like orange juice or something helps perk them up. Another thing to know is a fetal Doppler is sometimes something that is sold and recommended to use throughout your pregnancy to check on baby's well-being. This would not be our recommendation at this point as well. At this point, we want to use baby's movements as an indicator of how they're doing, as opposed to whether or not they have a heartbeat. Because one, most of us are not familiar with what the different heart ranges mean and what means that baby is doing well versus not doing well. And there's also more to their well-being than whether or not they have a heartbeat as well. And so if you have a fetal Doppler and you're using that at this point of your pregnancy to give you reassurance that baby is doing well, if you are noticing decreased fetal movement, we would still recommend going and seeing your provider and not using the Doppler as an assessment tool.
If you checked baby's heart rate and baby still had like the normal heart rate range, it could give you this false reassurance that baby is okay when actually potentially there could be something wrong. But also, depending on your like how comfortable you are using a Doppler, it could give you this this false sign that something is terribly wrong, because maybe you're listening to your own heart rate when you listen and your heart rate is substantially lower than baby's heart rate, and that could be concerning and alarming for you. Other things that are happening, though, is baby's neuron pathways are starting to rapidly develop now that we're entering the 3rd trimester. So baby's brain is developing and starting to like form into like a baby, which is really cool. They're able to open and close their eyes, so they're practicing blinking. Their eyelashes are hopefully there by now, as well as they can still see those light changes. So they're able to like open and close their eyes to see the difference in like the amount of light that they see. Again, I don't know how much light they're seeing. That's a lot of layers still, but apparently there is a difference that they can see, which is really cool. And then the last thing, they're still putting on that body fat. So they're starting to plump up and get those little cheeks, those little rolls, depending on like how chubby your baby's going to be, but they're starting to like plump up. That's really it with baby for week 28. But how are you doing during week 28 is you could be experiencing all of those similar pregnancy symptoms that many people experience with the heartburn, like restless leg syndrome, insomnia. Gina is experiencing a lot of nasal congestion, and all of these things are just due to the hormone changes within our body and the increase in blood flow that is happening. One of the things that we haven't really discussed much is the skin pigmentation changes that can happen during pregnancy. And one of the things is people will call it like the pregnancy mask, is you'll start noticing like this like pigmentation change within your face, and it's like darkening of your skin tone. But it's like splotchy within your face. And it's usually on both sides. And one of the things that can actually increase it, so it's called melasma. And one of the things that can increase it is the sun. So like going outside can make it worse because the sun can actually cause it to darken more. So wearing sunblock on your face, in your body during pregnancy, like outside of pregnancy, it's still beneficial because the sun can still cause damage. But during pregnancy, if you want to decrease that risk of like the pigmentation changes on your face, wearing sunblock whenever you go outside can be really beneficial. Another thing that some people will usually bring up, especially as your belly is growing bigger in this third trimester, is people will come to the hospital and be like, I have really bad sciatica pain, like this like really bad sciatic pain. It's like my right side or my left side, and it's like shooting down my leg. And it's important to note that only like 5% of people who say they have sciatica pain, it's actually true sciatica pain. So sciatica pain is where the nerves are actually being compressed. And this could be the case because in pregnancy, you're having more swelling. There's increase in blood flow. And so there could be actual swelling being placed on that sciatic nerve leading to sciatic pain. But for most people, it's not actually sciatica pain. It's SI joint pain.
During pregnancy, we have more movement happening within the pelvic joints. And this is important because human babies have big heads, and we want to be able to increase pelvic diameters to allow baby to pass through the pelvis. And during pregnancy, your ability to create more space in your pelvis is significant compared to outside of pregnancy. So with all of this extra movement, certain movement habits we can kind of sink deeper into, and so we can kind of get stuck in certain positions a little bit more. Or there may be too much movement happening and the muscles supporting the joints are not strong enough to withstand the extra movement and instability. And so when it comes to SI joint pain, there's still a lot of things that we can do to help resolve it. But typically with SI joint pain, you feel it in the backside of your pelvis, anywhere from like your lower back area, deep in the glute, or maybe even towards like the bottom of the glute area. But primarily it's usually a little bit more towards one side. You may confuse it with sciatic pain. You may call it piriformis pain. You may even call it like low back or tailbone pain. But it's all kind of like that same area where there's just a little bit too much movement happening in this like key junction point within our body. So tons of movement is transferred through our SI joints. And when they're not quite feeling stable, it can cause pain. And so when it comes to resolving pelvic pain, we have so many solutions for you. We'll link some workouts down below that you can do to help resolve SI joint pain specifically. But first, we want to focus on the pelvic balance. So making sure that the pelvis can move well and we're not kind of stuck in one position. Professional help can include seeing a pelvic floor physical therapist or even a Webster certified chiropractor. And there's also some mobility exercises and strengthening exercises that you can do to help correct pelvic positioning. And then we can focus on the muscular balance. So how well are the muscles and the fascial lines supporting that pelvic joint working together to help stabilize? And this is where more exercises can be really beneficial, particularly the strengthening exercises that we can do. And so commonly when somebody has pelvic pain, they come to us and they ask what stretches they can do, because usually we think stretching is going to help relieve my pain, when you actually might need some strengthening exercises. And so again, we'll link down below our top recommendations for pelvic pain, both our blog and then our specific workouts for SI joint pain. And then know that we have a ton of resources within our prenatal fitness programs where we incorporate all of these pelvic stability exercises, in addition to our pain-free pregnancy workout program, if you want something specific for pelvic pain.
And during week 28, they might bring up 3 different tests during your OB appointment if you already haven't done them yet. The first test that they're going to offer is the gestational diabetes. They start offering this at week 24, so you might have already taken it at this point, but the last week that they usually offer it is week 28. So if you haven't done it yet, you're likely going to do it now. And this is to screen for gestational diabetes. If the glucola test comes back positive, so that range that your blood sugar was above the normal range that they recommend during pregnancy, they recommend doing the glucola diagnostic test, which is a 3-hour test. But not everybody has to do this. So if you come back positive, then that is what the normal recommendation is. The other two things that are offered during this 28-week is a TDAP vaccine. The TDAP vaccine stands for tetanus, diphtheria, and pertussis. The reason they're recommending this during pregnancy is not for tetanus, that we think you're going to hit something that's a rusty nail and get tetanus during your pregnancy. The reason that we're giving it to you is for the pertussis portion of this vaccine, which is like whooping cough. Babies are born and their immune system is not as strong as ours. It's still developing. So getting the TDAP vaccine during pregnancy is building up these antibodies within your body to pass on to baby to protect them from getting pertussis as a baby. It's also recommended for any adults that are going to be in contact with baby, and children above the age of 7 also get this TDAP vaccine to, again, protect the baby from developing pertussis. This is a very contagious virus that can kind of spread quickly to especially people who are immunocompromised, which baby is. If you have concerns about getting vaccines during pregnancy, this can be a great talking point to have with your provider about the risks and benefits of getting this TDAP vaccine versus maybe waiting till after pregnancy. And we'll link the CDC TDAP fact sheets in the notes below. Another thing that might be brought up at your 28-week appointment, and it also could have been brought up at 26 weeks or 27 weeks if you saw your provider earlier, is the RhoGAM shot. And this is only brought up to people who are Rh negative. So all of our blood types are either the letter, so A, B, O, or AB, and then there's a positive or a negative afterwards. That positive or negative means that our Rh is either positive or negative. This is what we inherit from our parents. So if you are negative, one of your parents were likely negative or both of them were. If you are negative and your partner is positive, there is a possibility that baby will be Rh positive. This is an issue if your body senses that baby is this positive and starts to develop antibodies against baby. Usually it's not an issue for the first baby, but if you develop these antibodies, this could lead to issues with subsequent pregnancies of your body noticing that this baby is like a foreign body and attacking it, and this could lead to complications for babies. So the recommendation is usually giving RhoGAM either if you have any first trimester bleeding or at this 26 to 28 week appointment to prevent your body from developing these antibodies. If you and your partner are both negative, you likely do not need RhoGAM because the likelihood of you having a positive Rh baby is pretty low. So if you are Rh negative and they're recommending RhoGAM, this could be a great conversation to have with your provider of, should I get my partner tested to see if they are positive or negative, to see if I really need this RhoGAM shot, or potentially maybe if you are feeling uncomfortable, discussing it more so you feel either comfortable making the choice to get it or not get it. So that's really it for you and baby for week 28. But how are you feeling, Gina?
Overall, feeling pretty good physically. No ailments or discomforts, which is nice, other than all of this nasal congestion.
Not breathing, not sleeping.
You would think eventually I would run out of snot, and it just constantly building up. I did have a 28-week appointment with my hospital-based midwife, and we did the gestational diabetes test, which I passed.
Flying colors.
It was like I didn't eat anything. I did the fresh test for it, which I find the flavor to be much more pleasant. And I still felt a little jittery just because it's 50 grams of glucose, but not as bad as I did with the glucola drink, which I felt like I was also very nauseous.
I couldn't drive after it.
I don't know. Yeah, because I had to take it an hour before my appointment, and the clinic is about an hour away, so I had to drive. And I'm I would not have been able to do this with a glucola drink. So I was really glad to have the fresh test option available to me. Past that, flying colors. My insulin sensitivity is fantastic. However, my iron is very low.
Critically low.
So my issue is that I'm borderline anemic. So, which I guess is
all her iron stores are gone.
I have no iron left, apparently. So I am starting to incorporate an iron supplement into my daily routine now, taking it on an empty stomach with some vitamin C, so orange juice to help with absorption. Currently, I take Needed's iron supplement, which is a really great option. We really love Needed. If you're interested in checking them out, you can use code MAMASTAYFIT for 20% off your first order. But what I really love is that Needed also gives recommendations for how much iron to take based on what your iron levels are. And so I just down the whole bottle because
Pretty
I
much.
am
That's all
negative
just
iron.
one bottle a day.
So in actuality, it's 4 capsules for the level of iron that I lack. So taking that daily to help really help. Some folks recommended also taking chlorophyll with it. So I'm going to try that and see if that helps like increase my iron levels. And so hopefully that will help me not be borderline anemic. I had no idea that my midwife asked me, like, do I even want my ferritin levels tested? And I was like, no, I'm totally fine. Like, I don't have any problems with anemia. And I was like, actually, might as well. You already got my blood. So yeah, I'm glad she did.
I'm glad she did as well. With iron, so I'm also anemic, so we are bonding over our lack of iron. But Gina has like a reason during pregnancy, like your decrease in iron stores are somewhat expected because our hemoglobin is made with iron. So our hemoglobin is how oxygen is transported within your body. So without that iron, it makes it harder to create the hemoglobin. So it's going to use more of your iron stores during pregnancy because it's creating more blood to transport oxygen throughout you and your body. So it's expected that it's going to decrease somewhat during pregnancy, but hopefully not to a critically low level like Gina and I.
It's like right on the border of like
blood transfusion.
Like you're in trouble.
But a lot of people will be taking a prenatal that has iron in it. And so they're thinking like, well, it's better that you're getting some of this iron than nothing. So we are still going to put this iron in your prenatal. When most of us, one, might not even need an iron. And two, it's not really being absorbed to the amount that you honestly would need it if you do need iron, because in a prenatal, there's a bunch of other vitamins and minerals that are in there that actually impede the amount of iron your body can absorb. It actually can like decrease how much iron is actually getting into your body at all. So one of the biggest things is calcium that's in a prenatal, because we need calcium, like very beneficial, but calcium and iron do not mix. And calcium decreases the ability of iron to be absorbed in your body. So Gina said she takes orange juice with her iron because vitamin C can help your body absorb the iron. But a lot of orange juices have calcium enrichment. So if you do take it with an orange juice, ensure that your orange juice does not have added calcium in it. Because that could actually impede it, and when it really doesn't help. Like the vitamin C can only help so much with the calcium in there. So using just like fresh orange juice or any sort of juice with vitamin C can be beneficial to take that iron with. But this is also why finding a prenatal that doesn't have iron and then taking your iron separately can be beneficial if you actually are anemic, because the iron that's in your prenatal is really like taking a Tic Tac for a headache. It's not going to be doing much for your iron levels as taking iron separately. I usually find taking my iron as soon as I wake up in the morning when I'm still in bed with a full glass of water, or right before I go to bed at night when my belly is pretty empty. Because it can upset your tummy and it also can cause constipation. So making sure you're drinking lots of water and increasing your fiber throughout the day if you are taking an iron, because no one wants to be constipated during pregnancy or just at all.
The other thing that happened at my appointment was we did a growth ultrasound because I do have hypothyroidism. So my thyroid is also on the low functioning, and I'm really just...
You don't have iron
I'm
and
thriving.
You don't have thyroid.
I'm thriving in this realm. And so because of that, your thyroid can really impact how well your baby grows throughout your pregnancy. She's perfect. She's right on track. Her head is a little bit bigger than the rest of her body, which is standard for my children. So she's growing really well. She's also head down, which is really cool. If baby is head down at 28 weeks, they're more likely to be head down at term as well. And then vice versa. If baby is breech at 28 weeks, they are also potentially more likely to be breech still at term. And so at 28 weeks, again, we still have like 12 to 13 weeks before we're giving birth. That's a lot of time to figure out your options. And so if your baby is breech at this point, it can be really helpful to start having conversations with your provider on like, what happens if this baby is still breech at term? What are my options with you? And if you like the options that your provider offers, then stay with them. If you don't like those options, knowing that you are potentially at a higher likelihood of baby still being breech at term, you may want to start exploring other providers. So if your provider's only option for a breech baby at term is a scheduled C-section, and that is not the only option that you want to have, you may want to start finding a provider that offers other options as well, such as maybe they're going to do an ECV, or maybe they support vaginal and breech birth. But at 28 weeks, you have a lot of time to find a new provider if you need. And so I would recommend, if baby is breech at this point, to start exploring that with your provider now, as opposed to waiting until 36 weeks when you're kind of running out of options at that point. It's not impossible to switch at 36, 38 weeks, but it's definitely much, much harder to do so. You can also start doing more movements to help encourage baby to get in a head down position, such as inversions and movements that help release tension in the lower uterine ligaments, because sometimes babies are breech because there's not enough room for them to get head down. And so inversions help to stretch the lower uterine ligaments to create more space in the bottom part of your pelvis. But if baby is head down, you can still do inversions as well, because again, the inversion is not necessarily flipping your baby. It's creating more space in the bottom part of your uterus, so a head down baby can get into a better head down position, because it's not just head down, it's also like whether or not they're tucking their chin and they're presenting much smaller as well. So in the first week of my third trimester, I'm definitely doing a lot of like birth preparation exercises to help release tension in my uterine ligaments. We'll link the workout that I'm doing down below, and also incorporating a lot of birth preparation exercises to help create more space within our pelvis. What's really nice is our prenatal program already syncs to that, because it syncs to my current week of pregnancy. So I'm already incorporating all of those birth prep exercises into my daily workout routine. So I don't have to do like a whole separate workout that's just birth preparation, which is super nice as well. But overall, feeling pretty good, was like really happy with the appointment. The midwife was really great about like offering different options to me, but not kind of pushing me in either direction. And so when it came to the TDAP vaccine, she was like, if you're interested, this is something that we offer at this point. Like, if you want to take it, we can offer it to you. If you don't, that's fine. And then she was willing to kind of discuss like pros and cons of it. And so for me, knowing that the TDAP vaccine is going to help with babies' immunity when they're first born, knowing that they're not going to be able to get their own vaccine for about a few months was like really reassuring for me. And so each pregnancy, I have opted to get the TDAP vaccine, but I totally support if you're not as comfortable with it during your pregnancy as well. So having that conversation with your provider can be super beneficial. So thanks so much for tuning in to week 28 of your pregnancy, now that we have entered into the third trimester. So there's a lot of stuff happening at this kind of transitional point within your pregnancies. That's why this episode is so much longer than the other.
There's a lot of info.
But if you are pregnant and entering your third trimester, be sure to comment below to let us know how you are feeling, because we would love to connect with you throughout your pregnancy journey. If you want more support from us throughout your pregnancy, be sure to check out our online prenatal fitness programs. We offer an app-based format, which is a more self-paced workout, and an on-demand format, which is full-length workout videos that you follow with at the same time. And again, it syncs to where you are in your pregnancy. So you can join our third trimester on-demand program or week 28 of our app-based program. And so you can already know that the modifications that are included and the exercises that are included are appropriate to your phase of pregnancy.
And if you're looking to learn more to prepare for childbirth, we have an online childbirth education course that we discuss the science of labor and birth to take away some of the mystery to make it less scary. We also discuss a lot of birth options available to you to bring up with your provider and have a conversation of what birth options are, even available to you and that you would actually like to utilize. And you can bundle our prenatal fitness and our childbirth education together to save an additional 15%. And then you can use code YouTube10 to get 10% off on top of that. So 25% off the bundle. And you can check out all of our bundles and all of our offerings at our website, mamastayfit.com.